My name is Jemiah Williams, and this is Lee Central High School COVID Update, where we regularly inform you about COVID with our state epidemiologist, Dr. Bell. Statistics show there have been a total of 2,704 cases reported of COVID-19, with an average of 4 cases per day. This makes up around over 16% of Lee County's whole population. Now, let's go to Alexis Wilson and Dr. Bell to hear what they have to say.
Especially there are many questions about the vaccine. And I will say while we're on camera, that because we said this off camera, that I understand that each of you here has been vaccinated. And I cannot congratulate you, your school, your leadership for having made that choice to opt into a medically proven intervention that will help protect you and keep you safe. And if more people could pursue that, if they could get their questions answered, because I understand the hesitancy, but what I want people to understand is some of the questions that they're asking, as we've talked about, don't really come from credible sources. Some of the information that's being spread about the vaccinations, potential harm they can do, potential risks, are largely unproven. So people are unfortunately avoiding something that can really stop the spread of the disease and help prevent in individuals hospitalizations and deaths, and they're avoiding that because of misinformation. And so I encourage people to continue to ask those questions for people that are there to help you, healthcare providers, public health officials. But I also feel that people are so focused on the vaccine that they're forgetting about the disease itself. And the threat of the disease, especially in African American communities, is so significant that communities of color cannot forget that and should not forget that. As African Americans, we are dying at a higher rate than we should be. For many reasons, we have we have a higher proportion of underlying health conditions that put us at higher risk of being hospitalized and dying should we be exposed. And so there are so many more reasons for us to take advantage of this vaccine to protect our health and protect our communities. We have many communities. I think in the community where your school is located, they have lower vaccination coverage than do others. And so there's a great deal more that we can do from communities, from institutions, from schools to recover from this pandemic much more quickly. If we could get our vaccination rates up much more quickly, especially as we're moving into the holidays, we're only a week away from Thanksgiving now, so it's getting a little late to be fully protected from vaccination before Thanksgiving. But as we begin to travel more in the holidays, for the Christmas holidays, we can be well protected moving into the Christmas holidays if people are better informed about the benefits of the vaccination now. It takes about 2 weeks after completing a vaccination series to get fully protected. And moving into the holidays, and we want to be with our family members, and we want to be safe. I've seen far too many instances where there were avoidable adverse events. Family members who got sick from other family members and ended up being hospitalized and even worse. Many deaths that could be prevented. So I don't want to go on too long, but the main message that I want to convey is that we have a way out of this, and we have to maximally take advantage of, of those measures, those prevention measures, most importantly vaccination. And really bright young people like yourself who are interested in how to educate the population. I think all of you at your age should not be discounted as not only future leaders, but of current leaders. And the message that you can convey can really change the lives in your school and your communities. And I just want to take this opportunity to applaud you for the research that you've done, the questions that you're asking, and your pursuit of learning will go a long way in your community. And you and your classmates stand to help a lot of people. And I don't want you to miss that.
Thank you, Dr. Bell.
Thank you.
We're happy to bring to you more information about COVID-19 to try to keep our community safe. Make sure to stay tuned for more updates. I'm Jemiah Williams, and until next time.